Hey guys, it's me, Katie. I just got back from surgery and everything's looking really good. I just need to get some rest and keep icing, and hopefully I don't get any bruising. Oh, hold on. It's actually time for this to come off, so. Gotcha! It was just a 4 strip. But I am getting my nose done, so stick around. Hey guys! This is a video I really never thought that I'd be doing. So the reason why I wanted to make this video is because when I found out that I was getting this procedure done, I looked up a bunch of videos because I'm the type of person that, like, if I don't know exactly what's going to happen to me, I freak out. So I need to know every little detail. And I watched hundreds and hundreds and hundreds of videos, and there was still some questions that I had. So I wanted to come on and kind of, especially with this video, because there's really not too many videos about the before the surgery and things you need to prepare and things like that, and I just wanted to do this. And this will probably be either like a 2 or a 3-part video, just for like before surgery, recovery, and then like maybe final result or update or something, I don't know. So I have a folder with all of my information for my surgery, and let me just tell you what I'm getting done specifically. So my specific surgery is an open septoplasty, a vestibular stenosis repair, reduction post-traumatic dorsal irregularity, reduction post-traumatic dorsal irregularity, oh my gosh, and osteotomy, SMR turbinate, possible rib/ear graft, and I am getting cosmetic surgery done technically because my nose is actually not cosmetic, it's actually medical, but I am getting a chin implant and a chin augmentation for that right there. Kind of how this whole journey started is because of my chin. For the longest time now, I have been incredibly insecure about my chin and my profile. It was just one of those things that I personally didn't like in pictures, and I would constantly come home and like cry to my mom, and it was always just like such a big source of anxiety for me. It always made me feel like I wasn't feminine enough or pretty enough, and kind of sucks to feel that way. So my mom and I discussed maybe getting plastic surgery. So I did a lot of research, and I actually watched like surgeries and things like that, and basically I came to this decision that I wanted a chin augmentation. So I personally have a weak chin. You can tell that because if you put your finger here, your chin should rest, and I have space. The chin is a really big part of just the face harmony in general. So a lot of the times when people get like actual nose jobs, the surgeon will recommend getting a chin implant, because when this is really small, it makes your nose really big, but when this is really big, it makes your nose really small. So if you have them at like a good level, they really like equal out and look really nice together for aesthetic reasons. The results are very, it's like not obvious, it's very natural. It makes your profile really look better. It doesn't really change anything to the front of your face. So I had decided that I wanted this. We were going to originally do it the summer before I went to college, but it didn't really work out. We started actually looking for consultations winter break. I actually had 2 consultations. My first one was kind of spur of the moment. We went in, he looked at my chin. The doctor also had a surgery center in like his specific office rather than doing it at a hospital. So it was just kind of like, I don't know, this surgeon just didn't really work out for us. He was nice and he seemed really knowledgeable and everything, but it was also one of those things, I think especially that the surgery was going to be done in his office rather than a hospital, that kind of freaked us out, and we decided we didn't really want to do it. So we continued to look for new surgeons. If you're going to be doing a surgery like this, you want to meet multiple people. Make sure that you have the right person. If there's even like a doubt in your mind about someone, or like you don't feel correctly about them, or you don't trust them completely, it's not really worth it. Actually, a member of my family, she actually recommended me to her surgeon, and she said that he was really awesome. He was like an artist, a perfectionist, like so good. So we went to this new surgeon. We met him as soon as he walked in the door. And this is the part that like is completely freaky to me. On my sheet, I just wrote chin implant. I did not write anything about a deviated septum anywhere, nothing. He walks in the door and he's like, "You have a deviated septum." And I was like, "What?" He's like, "Yeah, I can tell from here." And he started talking on and on about my nose, what he wanted to do to it. I mean, if you've seen my other videos, you know that for a while I had a nose ring. He told me right away that the nose ring that I had was done improperly, and it was actually wearing the cartilage down in my septum, and that could eventually lead to cancer. So I took that out. I was like, not worth it. So he was super knowledgeable, explained everything really thoroughly. I didn't question anything. It was just kind of like one of those things. He was so confident about everything that I just kind of knew that this is the surgeon for me. And not only is he a plastic surgeon, but he also does a lot of work for people like reconstructive surgery. So like people who are in like really bad car accidents and like lose half their face, like he does a lot of surgeries to help fix that. So things like that. So not only is he like really good cosmetic surgery wise, but also medical surgery wise, I guess. I don't know. But yeah, so I'm going to explain what's exactly going to happen. So basically it is an open septoplasty. So they do cut right here, and they kind of like pull it up. It's really gross. If you want to see more of like what that looks like, you can look up tons of surgeries online. But yeah, so basically they're going to re-break my nose and fix that since it was broken. It is broken already. Actually, if you look like really closely right here, if you run your finger, there is like a big crack in my nose. So I know now that I definitely have broken my nose. So my nose will be straighter. What he told me is like everything that they do cosmetically to like make your nose look better is also how they fix your nose. So just like my nose is gonna look different no matter what. But like I haven't showed him pictures of what I want. He hasn't really like showed me any of like pictures of what it's gonna look like nothing. Like this is really not cosmetic. I don't know what it's gonna look like. I don't really care what it looks like as long as like it's not chopped off my face and I look like Voldemort. Like I'm cool, you know? I just want to be able to breathe. I also have really bad nosebleeds and things like that. Not like Tana Mongeau level, but I do have nosebleeds. So hopefully this will fix that a little bit. They're going to, I have a really pinched nose. So like this area right here is so thin and so fragile. That's why that it did break, is because my nose is just so thin and fragile that it's just like done. Anytime like you bop it, she's broken. So they're going to add some grafts. So they try to get, what he said is like 99% of their patients, they're able to get grafts from the septum. So if they're not able to, which 99% of the time they are, but if they're not able to get it here, then they do have to get some grafts from behind your ear. And then if they can't do that, then they have to get it from a part of your rib. So this takes like, I think like 3 weeks or so to heal. This takes like 6 weeks or something crazy, and it's so painful. So we're hoping that I don't have to get a rib graft. I can just get it from my septum, hopefully. We're praying. But yeah, so they're going to add grafts along here so it's a little bit more stabilized. It's not as pinched and it's not as thin, so then it won't break again or have the chance of breaking again. My surgeon was unlike the first surgeon, was like, no, you should file that with insurance and we're gonna do it in a hospital and it's gonna be good. But now I'm gonna kind of talk about the pre-op stuff. So this is what you have to do before the surgery, because this is honestly, I didn't really see that many videos on this. I only saw them surgery on, like recovery and everything, which I totally understand. you want to know how the recovery is, but also I wanted to know like how you prepare, how you get through nerves, you know, things like that. So I want to kind of like take you along for the rest of the week. I have, including the appointment that I had today, 3 appointments this week for this specific thing. I just got back from my pre-op with the hospital. I have, this is so bougie, but like my surgeon, he wants the best result. He's a perfectionist. He's like, so to make sure that you don't break out under your cast, we're gonna hook you up with a hydrofacial. So yes, I'm getting a hydrofacial tomorrow. On Saturday, I have a pre-op with my surgeon's office. And I think that's basically where they just go over like my medications and what specifically I use them for. I have a packet here that kind of explains everything for me. For my specific surgery, there is certain instructions that I have to do 2 weeks prior, the week prior, and then the few days prior type thing. So I literally just came back from school, from college yesterday, Monday, the 13th. I literally just finished my finals, so this sucked. It sucked so badly. So I had to get off of all medications, well, not all medications, but basically anything that contains aspirin or ibuprofen or anything like that, because it can interfere with normal blood clotting and it makes you bleed more and it's an issue. So I was really scared. They give you a whole list of things that you're not allowed to take. So you can't have like anything, like there's a whole list of medications I wasn't allowed to have, which included the only thing keeping me going this entire semester, which is my protein shakes, which I put in my coffee. So I had to stop those, which sucked because I don't like coffee without my protein shakes, and so I wasn't able to have coffee during finals. I had to stop basically all of my medications except for an anti-anxiety pill, and it was just not good. So yesterday was officially 1 week until my surgery, and like 1 week you can't drink any alcohol, can't have any drugs. Not that I would have any anyway because I'm a good bean. So I'll kind of walk you through this, but I'll just kind of tell you right now what it says that I had to do the night before surgery and the morning of the surgery. At midnight, I have to start fasting. I'm not allowed to eat or drink or have anything in my system at all. A lot of people find that this is really frustrating, especially in the mornings, and I agree. I think it's going to be so annoying because I'm so used to waking up, drinking a bottle of water, and like going on with my day. Won't be able to have water at all in the morning. Nothing. I can brush my teeth, but I had to make sure to spit the water out. Like, that's what they say. So I have to take a shower the night before and the morning of, and I had to use this soap called Hibiclens. It looks like this. I'm not allowed to use this on my face though, so I do have to get like antibacterial soap, so I'm just gonna get Dial, call it a day. But afterwards, you are not allowed to have anything. You can't put on deodorant, you can't put on lotion, you can't put on anything. Literally all you actually have to like wash your sheets in your bed. They have to be like freshly laundered before you can go to bed. You have to wear freshly laundered like clothing. Like, you cannot be dirty. And you have to wear like clothing that like you can like button up, like not put over your face. Thing that we have here is acetaminophen. God, I think this is pain medication. It says take 1 tablet every 6 hours. It's an opioid. That's scary. Next we have this bad boy, which is a mouth rinse. Actually, I forgot to tell you this. The chin augmentation, actually my surgeon is going in through the inside of the mouth. And also he's not doing any liposuction because he's been in the industry for so long. They found that eventually, like 20 years later after you've done like liposuction or anything, there starts to become like weird lines in your skin that like look really weird. And he's like, I don't want that to happen for you. So he doesn't want to do liposuction. He also said that I really don't have too much fat. He said that I have muscle, which like, excuse me, like if this is muscle, my whole body is muscle. But he said that it's really not that bad, and so he just refuses to do liposuction, which I actually kind of like. I kind of admire him for being so dead set, and like I don't want anything, even in the long run, even 20 years from now, making you regret this surgery. So it's kind of cool. Because I have stitches inside my mouth, I have to be on a liquid diet for a while, and I also have to, after every time I eat, I have to take a swig of this mouthwash. So this is Clorox Hexidane rinse, and I have to swish in my mouth for 30 seconds 2 times a day and then spit out after meals. So that's what that is. So this is Mupirocin ointment. This is for MRSA, MRSA, Mercedes-Benz, which is like a staph infection, I think, that can be caught in hospitals. So I have to, like 3 days before, 3 times a day, I have to apply this ointment in my nostrils. Okay, so this is ondansetron, which is actually, it's for nausea. What's next? We have great. Methylprednisolone. So this is for swelling, I think. Looks like birth control, weirdly enough. Next, oh, cool. We have saline nose spray. It's the CVS brand. Yeah, and I don't know. I guess it's just to keep my nose clean, probably. Last but not least, we have amoxicillin, which this is my antibiotic. So they give you an antibiotic so you don't develop or get sick or anything after your surgery. But this is amoxicillin and Clav. So that's all my medications. We love a medicated girl. Cool. I am makeupless and heading to my hydrofacial. I thought I'd check in with you guys and show you a little outfit of the day, because like kind of feeling myself. Also, she's kind of feeling herself too. Look how cute you are. Look at that profile. That's what I want my profile to look like. That right there. You're so, oh, rude. So we're a little hippy dippy today, but I'm just wearing a top from Forever 21 and this skirt. I don't know what brand it's from, but I got it from a Half of Half. Yeah, so I just got back from my hydrofacial. I'm like a little dewy right now. She did more of like the sides of the nose rather than the top of the nose, so she didn't really go over this area, which has like most of my blackheads and stuff, but like that's fine. But yeah, it was kind of weird. I wouldn't say that it was like relaxing. It felt like a cat licking your face. So there's like it's like kind of abrasive, I guess, in a way. So it like scratches your skin and then lets the water and hydration and different things go into the face. They just kind of like washed my face. They did the weird cat tongue thing. They did that about 2 times. So there's like a hydration one, then there's like this acid one that kind of like, you know, It kind of tingled and like stung a little bit, but like it wasn't bad. And it's just supposed to like get rid of any bacteria or anything. And then she did a mask and put me under blue light. And then she went over again with another type of, I don't know what the third one was, I can't remember. Or maybe there was 4, I'm not sure. But, and then she put on some sunscreen, and yeah, feeling good. She also popped my pimples up here. Like, it's actually like kind of like smooth. Before it was like all bumpy to the touch, but like, you can only see it, you can't feel it, which is kind of cool. Sorry I didn't get much, footage there, but I felt weird filming inside because I'm new to YouTube. Anyways, yeah, so that's the update. I'll see you guys later. Alligator. Cool. Bye. You good? Hey guys. Okay, so it is Saturday, and that means that I'm officially 2 days out from surgery. I have my pre-op today, which I'll talk about a little bit later, but I did want to show you my ointment that I had to put on. I started this yesterday, but I looked really weird yesterday because I tried some new products, makeup products, and I looked really strange, so I didn't want to film. So I had to apply this into my nostrils before 3 days before surgery in order to prevent MRSA. So I basically just take, here, Amame, will you hold the camera for me while I do this? Yeah, okay, cool. So I just take it. Stop smiling at me.
Can't help it, baby.
And I get about, unfocus on me, focus on this, like that much. And I use this much for one side of my nostril. So I go in and put it on this side. And I get a little bit more. And put it on this side. And it's for sanitary reasons. I flip the Q-tip over. I feel so dumb. I do this side. And this side's always bloody. Literally okay. All the time.
That is gross.
I'm not gonna show them.
Thank you.
It's always but like literally every time I put it in, it's bloody. Anyway, that's my MRSA.
Anti-MRSA.
Anti-MRSA. Hey guys. It's Sunday, the night before surgery. I was going to talk a little bit about the pre-op that went on yesterday that I mentioned in my last update, but like honestly, it was kind of dumb and kind of pointless because we went to the doctor's office, which was about an hour's drive. When we got there, they took my blood pressure and they said, "Do you have any questions?" And that was it. Which, I mean, I guess it's good to answer the questions, but it just seemed like it was something that we could have done on the phone or something. Not something that I needed to go there, like, all the way over there to see them. It was, like, literally we were there for, like, 10 minutes. Like, I kind of get why nobody vlogs the pre-op portion, because it is a little boring. But, if any of you were curious, I thought I would show you. It is about 10:30, and I have to start my fast or whatever at midnight, so I'm just trying to drink one more glass of water just so I don't feel so like gross in the morning, because I typically wake up and I try to drink water because I always feel a little dehydrated in the mornings. I did just shower, as you can see by my wonderful wet locks that look frizzy as heck. So there's a certain way that you have to shower. They give you the soap. So the first thing you have to do is like shampoo your hair. I conditioned my hair first just so I could get all the tangles out, and then I shampooed all that conditioner out and everything. And then you wash your body with your regular body wash. And you, so I just used Dial bar soap and I used that on my face. And I washed all of that off, and then I used the Hibiclens or something like that on the rest of my body. So I had to like turn off the water, put the Hibiclens on. It was kind of weird. It was like red. It didn't lather, so that kind of like weirded me out because I wasn't sure how much to put on. So I kind of went like ham. And it's supposed to sit on your skin for like 3 minutes. So I had to like turn off the water and just kind of sit there for 3 minutes and then like rinse it off. I had to change all my bed sheets, and I also had to, my cat normally sleeps in my room and she has to sleep somewhere else, which is really sad because she's not really like, she's comfortable around my house. She just doesn't feel as safe anywhere else other than my room. So it's really sad because she's gonna have to be like, not have her comfort space tonight, but it's just one night. The only different thing I had to do today was take an arnica pill, and I actually opened the capsule and just like sucked on the insides that way, so it goes into my bloodstream instead of just in my digestive tract, and it goes a little quicker. So I had to take one of those, and then throughout the recovery process I had to take some more arnica. So I wanted to talk a little bit about like the feelings I've been having lately about this particular surgery. I have had surgery before. When I was about 3 years old, I think, I had tonsillitis, so I had to get a tonsillectomy, which is basically where they just like snip off your tonsils, because I was always sick. Yeah, so I was really young. The only really side effects I had was nausea, but I'm a really nauseous person. Like, I get nauseous from walking around sometimes. I'm gonna get some more water, hold on. That was really the only thing that happened with me, is I like puked after surgery, but I was so young I don't really remember any of it. So this will be my first surgery that I've ever had where I actually remember or like will be aware of the things that are happening to me. So that's kind of like what makes it scary. I think also another thing that makes it scary is this isn't anything that like is life-threatening, you know? Like, this is something that it'll be helpful and it'll make my life overall like better, but it's not something that I need or like you know, not something that I can't live without, which I think is another thing that kind of makes it scary, because if something were to happen, it's almost like my own doing. I've done a lot of research on both of my surgeries, and I'm so confident in my surgeon, and I know that he's gonna do so well, but it's always just kind of a fear, you know? Losing control. I'm not like really the type of person that's very good at like giving things up, and so like going completely under and having your life in somebody else's hand like completely is just like really scary. We kind of made this surgery kind of final in, let's see, December. So I've been sitting on this for a good 6 months, and I went through a lot of phases. The main one was this weird feeling that I was like genuinely not going to make it through the surgery, and it was like so subconscious. I mean, like, I started off joking about it, and I guess that just kind of manifested, and it became so unconscious. Like, I remember I was watching Emma Chamberlain's birthday baking video, and she mentioned that her birthday is on May 22nd and my surgery's on May 20th. So like, without even thinking about it, I just like immediately thought like, it sucks that I won't be around for that, you know? Like, it was such a subconscious thing, and that really scared me. I was like but also like, it was one of those things like, yeah, I guess most people, if they feel that like much fear, they would just like not do the surgery. But it's one of those things like, I'm not gonna live my life in fear, and I know logically I'm not going to get hurt in this, or I'm gonna get hurt, they're gonna break my nose, but I'm not gonna die from this. That why would I just like not do it, you know? Like, I'm not gonna live my life in fear. I'm not gonna let fear dictate what I do or I don't do, because I've been wanting the chin implant for the longest time. For like, literally, I've been thinking about this for 3 years. And B, with the nose, I'm gonna benefit from it. I'm gonna breathe so much better, and I'm not gonna hopefully have as many nosebleed problems. It was actually really sweet. My mom, she knew I was struggling with this and that I was really scared of this and really freaked out. And so this is kind of just like a side note, and I'm gonna have a whole other video kind of like primarily about this, but my mom and I are starting a jewelry business where we find broken jewelry and we fix it. A lot of the times it's like designer brands and stuff like that, and we fix it / make it our own, and then we're going to be selling it. And so one of the necklaces that she found was this necklace that said Fearless, and I can't wear any jewelry right now, so I'm not wearing it, but I've been wearing it ever since. I think another reason why it's so weird is because, like, genuinely, I'll think about the future and I'll think about things happening like next semester of college, or me moving into my apartment, or even just like simple things like recovering, you know? And it's just weird because I can't picture myself. Because like I genuinely, like, I don't know what my nose is gonna look like. I'm not sure exactly what my profile is gonna look like with the chin. Like, I don't know. And so it's just weird because I'm trying to picture myself in my new apartment or something, and I can't see my face because I don't know. Like, I mean, genuinely, I don't think it's gonna change that much, but it's just one of those things, like, I'm not gonna look like I'm not gonna look like exactly the same. It's this weird thing, like, well, if I can't picture myself in the future, is there a future? I guess is kind of like where the basis is, maybe, of this fear of not living through this. I don't know. It's just like this weird phenomenon. Like, I just don't know what I'm gonna look like, and it's kind of freaky. But I mean, I don't know how I'm gonna react tomorrow. I think I'll probably have a few anxiety attacks. I think a majority of the anxiety attacks are gonna be like waiting, because I had to get there at 5 a.m. My surgery starts at 7. So it's a lot of downtime, and I'm not very good at downtime and having time to think through things because I always tend to go to the worst. So I'm better when it's just like everything's happening really quickly. I don't have time to think about something, because I'm really not a fearful person. I'm more of a worrier. Like, if something's in the moment, something's happening, I don't have time to think about it, I'm not scared at all. Like, I feel okay, I can get through it. But if I have like 6 months to think about something like this, then I think about every scenario, and I think about every little thing that's gonna happen to me or what could happen to me, and it's just like not a good thing. So, I mean, this is the thing. If you're seeing this footage, I lived through it, because I'm going to be editing this while I'm in recovery. So if this is posted on YouTube, I survived. So yeah, I guess that's going to be the end of this vlog. If you're interested to see how my actual surgery and recovery was, there will be a part 2. Thank you so much for watching. Have a nice day, or a nice night, or a nice evening, or, you know, rest of your life. And I will see you in the next video. Bye! Do I want to hit it? I don't know. It's kind of lame.